And then without further ado, I'm going to introduce to you somebody that's very near and dear to my heart. She and I grew up in Nash County, backyards back to back since we were 5 years old, and we've been friends ever since. Now we're both JoCo girls. We both live, she lives at Flower Hill. I live here in Kinley. So I might have gone 1,000 miles away, but we always stayed close at heart. And she has been with the Department of Insurance in Raleigh for over 10 years now, and she's going to share some stuff today with us with Medicare open enrollment coming up that is going to be very beneficial. And if she don't have the answers, she can probably direct us to someone in her office that does have an answer for us. This is a far and wide issue. Health, you can have all the money and the power in the world, but you can't buy your health. So, health care, paying for insurance, that crosses all genres and population areas. So I'm looking forward to seeing what Rhonda has to present today. And this is my friend, Rhonda Narron, and I want y'all to give her a good Kinley Baptist welcome. Matt, does she need to use that one?
Yeah. Okay. I'm not used to speaking into a microphone, y'all. My husband tells me all the time I talk very loud, but we'll go with it. How about that? So thank you, Laurie, for that great introduction. I'm Rhonda Narron. I work for the Department of Insurance, your North Carolina Department of Insurance. I work for the division that helps folks with their Medicare questions and concerns. How many of you have heard of SHIP? A few, okay. So that's where I work. It's called the Seniors Health Insurance Information Program. It's a big mouthful. SHIP with 2 I's for short. When I went to work there about 11 years ago, part of my job was answering the phone during lunch for our receptionist. People that had been working there for a long time would just pick up the phone and say, "Thank you for calling SHIP. How can I help you?" Well, I was new and I was scared that I was going to say the wrong thing. And you never know who's on the other end of that call. So I would always say the whole thing out, "Thank you for calling the Seniors Health Insurance Information Program." So SHIP exists to help you with your Medicare options. SHIP was created in 1986 by former Commissioner Jim Long in response to the overwhelming number of questions that the Department of Insurance was getting every month from Medicare beneficiaries across the state. And so we offer free, non-biased, confidential information about your Medicare health insurance options. We don't sell insurance. Often when we have a booth at an event, a community event, or at the state fair, and people come up to our booth, and when we say we're with the Department of Insurance, a hand goes up. "I don't need any more insurance." Okay. We don't sell insurance. We are the regulatory agency for the insurance industry in the state of North Carolina. So we help folks with their insurance questions and issues. We have a call center, downtown Raleigh. Well, we'll be moving out of downtown soon, but we'll still have a call center. And they are on the phones every day from 8 to 5 taking your calls and answering your questions and giving assistance to Medicare beneficiaries across the state. We can do in-person appointments. We can do virtual appointments. We never had the ability to do that before COVID. So I always say one good thing did come from COVID, and that's that we learned that we could do virtual counseling appointments. When you call our office, you do get to speak to a live person that is sitting in the Department of Insurance. That's one thing that we're real proud of, that we do provide excellent customer service. And we have a SHIP coordinating site in every county of North Carolina, and including the Cherokee Reservation out west. So we get a big pot of money from the federal government each year, and we funnel the majority of that federal money out to our coordinating sites across the state. And we operate those sites with a network of volunteers. Right now we have about 900 volunteers in the state. And last year, collectively, we served over 59,000 North Carolinians and helped them with their Medicare questions. Medicare's confusing. Just so I don't ever want to take for granted or assume anything. So how many of you are on Medicare already? Okay, a fair number. And then we have some that are not on Medicare, maybe approaching Medicare eligibility in the next few years. So there are 4 ways you can qualify for Medicare. Due to age, when you turn 65. If you've been on disability for 24 continuous months, or if you are diagnosed with Lou Gehrig's disease, ALS, or end-stage renal disease. So a lot of folks don't know that. Most folks, some folks just think you got to wait till you're 65. But there are some other ways that people qualify for Medicare. So no matter how you get there, whether it's due to age, or whether it's due to disability, or whether it's due to an illness, Medicare's confusing, right? There's so many moving parts, alphabet soup, So we are here to try to help folks understand their options. When you call our office, we're not going to say, Ms. Langston, you need to enroll in this plan right here. We will ask you questions. We're not being nosy when you call and we ask questions. We're just trying to understand and get the information we need to help you make a good choice. We want to provide you with the information that helps you make the best decision for your Medicare health insurance. That's all we do. We're there year-round. Open enrollment's coming up. Well, no, we're in open enrollment. It started Sunday. So how many of you that are on Medicare already have a prescription drug plan? Okay, a few. I have a question for you. Do you compare that plan every year? Do you compare your prescription drug plan to make sure that you are on the best plan for you for the upcoming year? You do? Great.
For him, I'm on state employee.
Okay, well, you're a state employee. If you're a state retiree, you got your own options, and so you will
Have to stay on that,
take a plan that they have, yes.
but you have to stay on that option,
Yes,
because we didn't one time.
right. You can get it back, but you have to wait to open enrollment for the state health plan each year. It can be difficult, but it can be done. If you have a drug plan, please shop that plan and compare it every year. And I'm going to tell you why. Those plans change every year from year to year. Medicare has this big master list, it's called a formulary, of Medicare-approved prescription drugs. There's thousands of drugs on that list. Not every drug plan that is sold is required to cover all of those drugs. They each have their own formulary, and those formularies can change from year to year. So you may go to the pharmacy all year in 2023 and get your prescriptions filled and they're all covered. And if you don't compare that plan and make sure that they're all covered for next year, you may go to the pharmacy and get a surprise in 2024 if one of those drugs has dropped off of that formulary of your drug plan. Not only can that happen, the premiums change. If you've got a drug plan, you've probably already gotten your letter in the mail telling you what your premium's going to be for next year if you stay on that plan. Those premiums change, the copays change, the deductibles change. So it's a good idea to shop your plan and compare it every year, and SHIP can help you with that. You can call our toll-free number in Raleigh, or you can call your local SHIP site. Your local SHIP site here in Johnston County is in Smithfield. It's Community and Senior Services of Johnston County. And that's where you would call to get local services if you needed a local SHIP appointment. I'm helping them with some counseling this year, so if you make an appointment through them, you may get to have it with me. So shop your drug plans every year. I want to tell you a story that will give you an example of why it's so important. Last year during open enrollment, I was counseling in Harnett County in Lillington with Harnett County Services for on Aging. This lady came in with her mother, and her mother was 92 years old, and she had a prescription drug plan, and she had never compared it since she purchased it when she turned 65. She didn't know she had to. Her daughter happened to see a flyer in the library that Harnett County Services on Aging had posted about Medicare open enrollment and compare your plans. So she talked to her mom, made an appointment, came in. That woman was on the most expensive drug plan currently sold in North Carolina. and her monthly premium was $121 a month. She took 3 generic prescriptions that had a 0 copay. So I was able to compare her plan and get her on a plan that covered those 3 generic prescriptions at a 0 copay, and her monthly premium went from $120 to $30, just because she compared her plan during Medicare's open enrollment. So please take advantage of that. It runs each year. It's an annual open enrollment from October 15th to December 7th, okay? So if you have an Advantage plan, does anybody have an Advantage plan? Not a state retiree plan.
I have my prescription on the state retiree, then I have the Advantage.
Okay, so if you have an Advantage plan, you need to compare that every year as well, because providers can leave a network. We were just talking about that earlier. If you have prescription drug coverage in that Medicare Advantage plan, your prescriptions can change. They can drop off of your formulary for your Advantage plan as well. You can compare that during the annual fall enrollment that's happening right now. But if you have an Advantage plan, a free market Advantage plan, not a state retiree plan or a plan from a company like IBM or any retiree coverage through a company, if you have a free market Advantage plan, you can compare that annually from January 1st to March 31st. So you have an additional open enrollment period for that. Now, how many of you are familiar with this Medicare New Handbook? This is a handbook for folks that are on Medicare. You get one per household if you're married. You get one annually. They've just been released for 2024. How many of you read this book when you get it in the mail? How many of you read it from cover to cover? No hands ever go up when I ask that question. Yesterday in Cary at a church I was at, one person came to me after it and said, I just want to let you know, I read that thing every year when I get it. Not many people do. It's not very exciting reading, y'all, and I know that. It's not exciting. But let me ask you to do me one favor. When you get this book every year, I want you to open it up and I want you to look on the inside front cover, because inside that front cover, they are going to list the new and notable changes for the upcoming year. And it's going to tell you what they are, and it's going to give you what page number they're on. So even if you don't want to read the whole book, at least look at the changes in the front of the book and maybe go to those pages and read about what's changing for next year. That's a good way to find out what's important and what might be happening next year that's going to affect you. For those of you that are not on Medicare yet and are approaching Medicare age or eligibility, we have a document called The Road to Medicare. It's short and sweet and to the point, and it just tells you what you need to be thinking about as you are nearing Medicare eligibility. I got some of these with me, and I'll be happy to share them with anybody who'd like one. One other thing I want to mention is preventive services. Medicare covers a long list of preventive services. They take up about 25 pages in that Medicare New Handbook. So there's a long list of Medicare preventive services that you're eligible for at no cost to the Medicare beneficiary. Here's a list. I mean, this is not an all-inclusive list, and I have a flyer, but it does include some potentially life-saving screenings and tests and vaccinations. Medicare now covers the shingles vaccine. So if you've not had your shingles vaccine, Medicare covers that now. It's covered under your Part B, so you want to take advantage of that if you haven't had it already. Let's see, preventive services. We talked about open enrollment. I have a Medicare Basics that just gives a grand overview of the different parts of Medicare. Does anybody have any specific questions about Medicare? About any of your Medicare options, or you have a question, Mr. Billy?
I do.
Okay.
I'll grab this mic and everybody can.
Okay.
My question is.
There we go.
Okay. My question is once you get off or go into an Advantage insurance plan,
Mm-hmm.
and I know it's has nothing to do, it's a government, but it's, I guess, other groups of people that's running it, it's not run by the government, is that
Right, they're sold by individual private insurance companies.
And, but I understand, once you get off your Medicare, goes to Advantage, it's hard to go back to a stopgap plan.
To a Medigap plan, a supplement plan. So Medicare is an 80-20 situation. When you're on original Medicare, Part A and Part B, Part A is your hospitalization coverage. Part B is your medical health insurance. Your doctor visits, your outpatient visits, labs, and things like that is Part B. Part D is your prescription drug coverage. So you can have original Medicare with a drug plan and potentially a supplement. You can purchase a supplement or a Medigap. They're same thing, tomato, tomato. You'll hear them referred to as a Medigap or a Medicare supplement. That pays the 20% of Medicare-approved services that Medicare doesn't pay. When you go onto an Advantage plan, that is Medicare Part C. That's your Advantage plan. And that combines A and B and D into one insurance product. They're sold by private companies. You're still on Medicare. You just receive your Medicare benefits through that Advantage plan instead of original Medicare, which is administered through Centers for Medicare and Medicaid Services. So his question was, what if you're on an Advantage plan and you want to go back to original Medicare?
Yes, ma'am.
If it's the first time you've tried an Advantage plan, you are able to go back to original Medicare and pick up a supplement. Now, you may not be guaranteed the same premium you were paying if you were on a supplement before, but you can go back to a supplement. A supplement, they are harder to change once you're outside your initial enrollment period. When you first enroll in Medicare Part B, that triggers a 6-month window for you to purchase a supplement plan. And if you apply for a supplement during that first 6 months that you're eligible for one, you can't be denied based on your medical history. They have to issue you a policy if you apply for one. Once you're outside that guarantee issue period for a supplement plan, it does become harder to switch. You can. There's no open enrollment for a supplement like there is for your Advantage plans or your drug plans. There's no open enrollment period. But you can apply to change after you're outside of that. You're just not guaranteed a policy. They will do medical underwriting and look at your medical history, and you may or may not be offered the sale of a plan. So we get that question a lot.
Thank you.
Uh-huh.
Thank you. The other thing is I know because I spoke with you briefly, but Donna and I both have got letters telling us that United Healthcare is no longer, possibly, they're still negotiating, but possibly no longer going to be associated with UNC Healthcare.
Right.
And you said that you knew that, but if anybody's receiving any letters, I take it they better be reading them because.
Yes,
you
if
said there was
if you're on an Advantage product and you are receiving letters that say, hey, we are no longer going to be in this network at a certain date, you need to pay attention to that because if you have an insurance policy that you can't use because you can't go to the doctors that you want to go to, you may want to make a change. And it's my understanding that UNC Network is dropping United Healthcare. They're dropping out of that provider network as of April of next year. So what that means for people that go to UNC providers, they're going to be out of network next year after April 1st. So you have an opportunity to purchase a new supplement policy. I know you see these commercials with Joe Namath and Martha Stewart and J.J. Walker that are advertising Advantage plans on television. Do y'all know who I'm talking about? Y'all have seen those? They are advertising for Medicare Advantage plans, and it's a third-party advertiser. So be careful of those type of solicitations. If you want to look for an Advantage plan or if you have one and you want to compare it, I would say that's something SHIP can help you with. If you have an agent that you trust, that's something an agent can help you with. If you have a trusted agent. But here's the most important question to ask yourself when you're looking at an Advantage plan. Can I go to my doctor? Can I go to my provider? Can I go to the hospital I'd want to go to if I needed one? Is the hospital that's closest to me in this network? Because some of those plans offer supplemental benefits that Medicare doesn't cover. And those are the benefits on that commercial that they're trying to make sound so enticing to people to get you to call that number, like dental and vision and transportation and grocery cards. We get folks all the time wanting to know, how can I get that grocery card they talk about on TV? And I say, let's get your medical insurance straightened out first. If we can get you a plan that you can go to your doctor, that's great. And then if it offers one of those supplemental benefits, even better. That's kind of like icing, sprinkles on a cupcake. You know, you need to get your medical part straightened out first before you worry about the grocery card and those kind of things. Because the grocery card is not going to do you any good if you can't go to your doctor and have it covered under your policy.
Thank you very much. Does somebody else have a question?
Oh, yep. I did have one other thing. Let me say one other thing real quickly about some assistance programs that SHIP can help screen for. When I was talking about your prescription drug coverage, there is a program that I wanted to tell you about called Extra Help. Extra Help is a federally subsidized program that helps people pay for their prescription drug expenses. It helps pay for the cost of the premiums, deductibles, and co-payments. Now, it's a federal program, so it's income and asset-based, but that is something that SHIP can help screen for, and we can actually help a person apply for if they feel like they may benefit from that program. So if you know anyone in your community here at Kinley Baptist or in your community where you live, or a family member that may benefit from Extra Help, I have a flyer with me about that program, and I just wanted to put that out there because we never know when we might reach someone who can benefit from that program. So just keep that in mind as well.
I also was told by our agent that it is against the law
Mm-hmm.
for just somebody out of the blue to call you for Medicare.
It is, and that's a great point. And let me say this to you, Medicare is not going to call you.
Exactly.
They don't. If you get a phone call and they say, Miss So-and-so, I'm calling you from Medicare, and I can help you get the Medicare plan you need. Hang up the phone, because Medicare does not do that. In fact, neither does Social Security or IRS. So, and you know, they call us all the time too. So just be aware, Medicare doesn't call individuals, and you don't want to get in a situation where you're telling them your personal information for them to use. So, good point. You got a question, Donna?
So my question is for those few in here who's not quite there yet.
Right.
So I was told by, like break room lawyer kind of conversation, that the insurance you have prior to turning 65 must qualify for you to get Medicare. That, and if you don't have insurance, you might get some penalty. Anything to that?
Okay, so if you're turning 65 and you are working and you have employer group health coverage, if you're going to continue to work, you don't have to enroll into Medicare. You can enroll in Part A at any time because it's free for most people. If you've worked at least 40 quarters or 10 years and paid into Social Security, Part A is free for most everybody. Part B comes with a premium. Everybody pays a premium for Part B, and there's some assistance that can be provided to low-income people who qualify to pay their Part B premium as well. You can delay enrolling in Part B as long as you have credible coverage. So if it's someone that's 65 and is continuing to work and they have an employer group health plan, they can delay enrolling in Part B without penalty. Now, if it's someone that's turning 65, doesn't have any kind of health insurance at all or whatever at the time, you have a window to enroll in Part B. You have 7 months. You have 3 months before the month of your 65th birthday, the month of your 65th birthday, and 3 months after it. Why wait? I always tell people, let's don't wait till that last 3 months. Let's go ahead and sign up when you're initially eligible so you don't miss it. But if something happens and you didn't know you had to enroll in Medicare Part B, you forgot to enroll in Medicare Part B, or whatever the situation is, there is a period of time every year called the general enrollment period. that you can enroll in Part B late. It's called a late enrollment, and there is a penalty. If you don't enroll in it when you're initially eligible, there is a penalty that's applied, and once that penalty is applied, it's a lifetime penalty, guys. It never goes away. Wow. Never goes away. So it's good to know ahead of time. That's why it's good to start thinking about it before you get to age 65. We need to know what our options are because it's confusing. It is confusing. And so we try to help folks with that and with that whole process. So just be aware of that. Also, same thing, if you don't purchase a drug plan, when you're initially eligible to purchase a drug plan, you're going to get a penalty. If you turn 65 and you enroll in Medicare and you are perfectly healthy and you are one of those unicorns that does not take any kind of prescription medication, do you need to enroll in a drug plan? Yes. Yes, you do. Because what's going to happen years down the road when your doctor does put you on a prescription medication and you don't have a drug plan, and you go to the pharmacy and it's one of these high-dollar prescriptions, and then you want a drug plan, you're going to be hit with a penalty to enroll in one. So there are some low-cost plans. This year for 2023, the cheapest plan sold in North Carolina costs $4.20 a month. So when we would counsel someone that was turning 65 and they didn't take any prescriptions, that's the plan we would say, hey, this is probably going to be a great idea for you since you don't take any prescriptions, and it'll give you coverage if you need it. For 2024, there's a zero premium plan being sold in North Carolina. So if you're turning 65 next year, but you don't take any prescriptions, we got you covered because there's going to be a prescription drug plan that is a zero premium. So that would be a great one for folks. It gives you coverage if you need it, and it's not going to cost you anything each month. Does that kind of cover your question?
Because I had heard it was a lifetime penalty.
It is. It is. So that's why it's important to know when you need to enroll and to ask those questions. And if you are going to keep working, then you're going to want to coordinate when you're going off of that plan with when you enroll in Part B.
What if you're over 65 and haven't enrolled in a drug plan?
Then you will probably incur a penalty if you've not had credible coverage. Now, if you're over 65 and you've been on a retiree plan that has credible drug coverage and that's ending or going away, then you would not have a penalty. But if you're over 65 and you've never been on any kind of drug coverage at all, then you would incur a penalty if you enrolled in a plan.
Yeah, what kind of penalty?
The
So
penalty.
what I want to do is be sure we ask these questions in the microphone because it is recorded for people who can't.
Okay.
who just
So
can't
the
be here.
question was, what kind of penalty is applied if you get a penalty for not enrolling in time? And for a drug plan, it's based on, and it's a calculated cost. SHIP doesn't calculate it. It's calculated by Social Security Administration based on the average premium of drug plans nationwide, and it's multiplied by the number of months that you could have been on a drug plan but didn't have one. Yeah. So for someone that's 70, that's going to be, multiplied by 60 months.
And I heard it'd be retroactive. Is that right, the penalty? Or does it just start with that period?
It goes back to whenever you were initially eligible to enroll. So it would be retroactive to when you turn 65 or whenever you lost credible coverage. Yeah.
Good information. Here's what I have learned today. When I turn 65, October 2nd, 2024, I'm going to go find Rhonda and Narron.
Yes. You're going to call me
Yes.
about August. We're going to start talking in August and looking at your options. Okay?
Instead of Billy Price, he would have been two. I want to go to Rhonda and Narron.
Yes. Okay. Now, one last thing I want to convey to you guys is protect your Medicare number. Medicare fraud is a real thing, and it is estimated in the United States that $68 billion is lost annually in Medicare fraud. Okay? So protect your Medicare number like you would a credit card. Don't give it out. If people call you on the phone and they're asking you for personal information and they say, if you just give me your Medicare number, I'll send you a back brace. Don't fall for that. Right now, a scam that's going on with Medicare beneficiaries in North Carolina involves COVID test kits. People are being sent COVID test kits, copious amounts of COVID test kits, and they're billing Medicare for them. And Medicare's paying $75 per test kit, y'all. Well, because these these companies are billing it to Medicare using people's Medicare numbers. And data breaches happen. We know this from our everyday lives. Our banking information gets, banks get compromised. So do doctors' offices. So do hospitals that have our personal information, that have our social security numbers and our Medicare numbers. And once these lists of numbers go on the black market, on the dark web, which I don't really totally understand what that is, they can get lists, they buy them. They can buy lists of this information, of our personal information. And then they can take that and bill for things that you've never received or for doctor visits you've never been to. So it is a real thing, and it really does happen. Several years ago, a common scam that was going around involved knee and back braces. So they would call, they would offer you a knee brace or a back brace for free, won't cost you anything. I just need your Medicare number and we'll send it right out to you. Well, my daddy ran a barbecue restaurant for 40 years. So he had a bad back and bad legs and bad feet. And so he gets a call one day about 6 years ago, and the guy on the phone was calling from a medical equipment company, and he said, Mr. Bissett, would you happen to be in need of a back brace? Well, Daddy had a bad back, and he's like, well, yeah, and he said, it won't cost you anything. We'll send it right out to you. So they sent my daddy a back brace. I'm still not sure. We never could figure out how this part happened in this story, but Medicare got the claim, and they paid it. And they made the check out to that medical equipment company. But they accidentally somehow mailed the check to my daddy. And when he got that check in the mail for that back brace, and it was made out to that equipment company, that check was for $1,700, y'all. $1,700 that Medicare had paid for that back brace that he could have went to Walmart and bought for $25. So that was a scam that was happening a few years ago. That one, and what happens is they shut them down in one town, they move to another town and set up shop again and just start it all over again. Thankfully, I work for SHIP, and I know that we have a senior Medicare patrol in our office that deals with Medicare fraud. And so I just gathered it all up in a folder, and I took it to them, and they handled filing a complaint with Medicare to get that taken off of my daddy's Medicare record, and they took it from there. So we do have resources. Check your summary notices. When you get your Medicare summary notice in the mail, open them up and read them. They come out every 90 days. If you see something on there that's a provider or a service that you know for a fact you did not have or receive, you need to say something. You need to call Medicare, you need to call SHIP, let us help you with it, or call Medicare yourself and report it, because that does happen. And it is, we want that Medicare trust fund to be there. We want it to be there for as long as it can be there, because we all want to take advantage of it. We've paid into it. We want it to be there for us when we need it. So those are just some things that you can help protect yourself by doing that and being aware of your Medicare number and your summary notices when you get them.
So did I understand that you're saying that for those of us who's got a closet full of COVID tests, that it was a fraudulent thing? No. Now, the United States government did provide free COVID testing to anyone who wanted them, free COVID test kits. What I'm referring to is a scam that really just is affecting Medicare beneficiaries, where there are companies that are setting up shop, getting a list of Medicare beneficiaries' Medicare numbers, and they are billing Medicare for these test kits and mailing them to the Medicare beneficiary.
when the Medicare beneficiary has never ordered them or asked for them, and it's being billed against their it's a totally separate thing than those free kits that we all were able to get from the government. That's a totally separate thing.
With the marked up price.
Yeah, and they're billing Medicare $75 per test kit.
Another scam is shoes and inserts.
You have to be careful with these phone calls. If they're cold calling you and asking you, hey, do you need this particular thing? If you didn't initiate a call with somebody, don't give out your information. If you've called and left a message for XYZ medical company to call you back, and they call and say, I'm calling from XYZ medical company, that's one thing. But if you just get a random phone call from XYZ and they say, hey, Miss So-and-so, I can send you some free COVID kits if you want them. No, don't do that. So, do we have any more questions?
I got a comment.
Okay.
If it says suspected spam on my phone, I don't.
Exactly.
But if it's another call, especially if it's a 919 area code number 252, I take confusion.
Because,
Because it might be.
right,
A lot of
exactly.
times it is somebody. But the answer I give them, if they ask me anything, usually they ask you how you doing.
Right.
I say something like this. I'm walking with Jesus. I'm one day closer to heaven. Almighty God, He's the way, the truth, and the life. And before I can get through all that,
Yeah.
so
and-
I feel like I'm witnessing
There you go.
at the same time.
You are. Awesome. And don't say yes. If they call and say, are you Miss Narron? Don't say yes. Because once they get your voice, they can record it. Then, they've got you on the phone, and they can take that and run with it and order things. Enroll. That's how sometimes seniors get duped into enrolling in a plan that they didn't even know they were enrolling in. We've had folks call our office all the time that say, I've got this, I'm just going to use this as an example. I've got this Humana plan, and I never asked to be enrolled in this Humana plan. Somebody called talking to me about them one day, but I never asked them to enroll me in it. Well, come to find out, if they get your voice saying yes, and it's a cold, and I know it's against the law for them to do that, but that doesn't stop them from doing it sometimes. So just be careful in these phone calls, not to let them get you on record saying yes to anything, because we don't want them enrolling you in a plan that you never intended to enroll in.
Yeah.
Yes.
I've had them scammers that I've always said, no, thank you. I hang up.
Yep, just hang up the phone. I know we're from the South, and we're friendly, and we've been taught all our lives to be friendly and courteous to people, but when they're calling us on the phone like that, we do not have to talk to them. So just be aware of those things. Remember to let us help you if we can help you in any way. That's what we're there for. And I also wanted to say one other thing about this toll-free number on our SHIP postcards. Like I said, if you call this toll-free number, oh, there it is, you can talk to someone about Medicare, a live person. You'll just follow the prompts for Medicare, and you'll be connected to somebody in our SHIP call center. If you have questions about other kinds of insurance, if you have questions about your homeowners or your car insurance, your life insurance, if you think there's a life insurance, you got questions about that. We also have a consumer services division that you can talk to by calling this toll-free number, and they will provide you information about whatever kind of questions you have about your insurance. So not only can you talk to a live person in SHIP, you can talk to a live person about other kinds of insurance as well when you call that toll-free number. Just wanted to put that out there because sometimes people do have questions about other kinds of insurance besides their Medicare. So we're there to help answer your questions. Let us help you if we can. Thank y'all for having me today. I appreciate it. How many people, who's learned one thing? Okay, then this is success. If somebody's learned one thing, I call that a successful event. Thank you so much. I appreciate it. If I can help any of you, let me know. And if SHIP can help you either locally at your local site in Smithfield or in our Raleigh office, that's what we're here for, and we're happy to answer your questions.
Repeat that name for the Johnston County.
The Johnston County SHIP site is Community and Senior Services of Johnston County. It's in Smithfield. It's out on Market Street as you're going out of town. And they also provide SHIP counseling in Benson and in the Clayton Senior Center. I don't think they provide it here at the Kinley. Is there a senior center in Kinley? I don't think they do it here, but there are some sites in the county, and they actually do counseling there at their office as well. So, thank you guys. I appreciate it very much.
Rhonda, we thank you.
Absolutely.
I mean,
Happy to be here.
I got quite a bit of education, and I know you've got an interesting job, and but I didn't realize that Medicare could be so screwed up.
There's so many moving parts to it.
Yeah, and
Getting all those parts to line up when you need them to line up is important.
yeah. And the good thing is you come to see us at an ideal time.
Exactly, because we're in open enrollment.
it's
Right
open
now is the
enrollment.
time to be thinking about your choices for next year. Yep,
So,
yep.
thank you.
You go out, you would go to meetings with no housing?
I will if it's somebody locally that maybe can't get out or whatever, or I can do it by phone. I support 20 counties in the southeast, so I'm out and about doing this almost every day somewhere. And also during open enrollment, I'm out in my counties helping with open enrollment counseling. But I am scheduling myself one office day a week to help folks in my community that need help and to help out with the SHIP call center. So if I can help you, I'm happy to. Donna has my contact information, Laurie has it, so I'm always glad to help anybody that I can help in my community, so.
And another thing, a lot of you, this is just a little tidbit, but our new police chief, Ayers, he used to work for the Department of Insurance.
James Ayers is a fine man, y'all. He really is. He worked for years with the Department of Insurance in our Criminal Investigations Department, and he is a fine fellow. When I saw he was coming here to be the chief of police, that really made my heart smile when I saw that in the news. So y'all are very fortunate to have him here.
And as y'all know, I guess Rhonda's a Flower Hill girl now. So she's not very far away.
No, I'm not. I'm right here, right down the road. So
Yeah.
thank y'all so much again for having me today. I
Thank you.
appreciate it.
And we hope
Thank
you'll
you.
join us for lunch.
I will. I can stay. I got to be out of here by 12:30, so I got a
Okay.
few minutes.
Okay,
Thank you.
Thank you.